Good morning. At the onset, I would thank AIOS for giving me an opportunity to present my work. It's on spectral domain optical coherence tomography for imaging palisades of Vogt in normal and in disease. It is a small case series. As you know, corneoscleral limbus, it comprises of epithelium and stroma, and palisades of Vogt are housed in this area. They have electron-dense basal cells called the stem cells, and the stroma has connective tissue with vasculature and lymphatics. Palisades of Vogt are the radial infolding at the corneoscleral junction. It's very unique. There is a term called conjunctival glyphics or lymphoglyphics to show the pattern of palisades of Vogt in different persons. It's individual hallmark, and what I have done is study the palisades of Vogt. This has been mentioned in literature. Optical coherence tomography as a rapid and accurate non-contact method for visualizing palisades of Vogt was done by Lathorpe et al. They found that anatomical characteristics can be clearly imaged with OCT. And high resolution OCT was done to study limbal stem cell deficiency by Shobhit Verma et al. And in vivo volumetric imaging of human corneoscleral limbus with spectral domain OCT was done by Biseva et al. In Biseva et al. Study, they used a research grade OCT, and a volumetric analysis of the stem cell was done, and extensive study of the palisades of Vogt was done. What I have done was, I have imaged the superior and inferior corneoscleral limbus with spectral domain OCT. 5 normal subjects, 5 females and 5 males were taken. 5 cases was taken, and the anatomy of palisades of Vogt was imaged. So this is a normal image of palisades of Vogt. What you can see, which is shown in star, are the palisades of Vogt, and the horizontal line depicts the interpalisade distance, which was measured, and the mean value was taken. The palisades of Vogt, because of the presence of melanin pigment, causes shadowing, which is seen by the arrow. So quantitative analysis and qualitative analysis was done. Superior and inferior limbus was divided into 3 zones. Mean palisade ridge height of 3 zones was calculated. Mean interpalisade epithelial retipe distance was calculated. These are the 3 zones as taken for the analysis. So the mean value correlated between both inferior and superior limbus. The mean value of superior limbus was in zone A was 80.90, zone B was 83.90, and zone C 81. In the inferior limbus, it was 93.50, 82.20 in zone B, and 81.970. As is described in anatomy, inferior palisades of Vogt are thicker as compared to the superior palisades of Vogt. The interpalisade distance also was comparable. It was a mean value of 81 in zone A, 73.40 in zone B, 76.80 in zone C in the superior limbus, and in the inferior limbus it was 70.70, 85.10 and 76.70 in zone C. So there were 3 anatomical patterns seen in the normal individuals. This is the standard pattern where we can see cylindrical palisades of Vogt which are non-confluent. And in lightly pigmented individual, we could obtain the attenuated pattern that has rounded dome-like palisades of Vogt with increased interpalisade distance. It was seen in 3 of the normal individuals. And in darkly pigmented individuals, exaggerated pattern was seen. There was confluence of the palisades of Vogt, and a continuum was seen extending in the palisades of Vogt area. Coming on to diseased individual, this is aniridia associated limbal stem cell deficiency. There is absence of palisades of Vogt, but shadowing can be seen in the OCT. In post-keratoplasty LSCD, we can see absence of palisades of Vogt, also increased vasculature in the corneoscleral limbus. In contact lens wearer, we can see diminished visibility of palisades of Vogt. It may show an early limbal stem cell deficiency developing. In inferior pannus, there is loss of palisades of Vogt with increased vasculature. In mixed etiology dry eye, there is decreased shadowing of palisades of Vogt with increased vasculature which is seen. So in conclusion, spectral domain OCT is able to visualize the structure of limbal palisades of Vogt and microvasculature of healthy human limbus without contact. It can be used as an investigative modality in harvesting limbal tissue for ocular surface reconstruction like SLET. Early loss of palisades of Vogt can be studied non-invasively. Future direction would be to collect a normative data on-face imaging of the vasculature to study the changes of the limbal vasculature, histopathological and immunofluorescence marking of the limbal tissue to identify the stem cell niche, and characterization of palisades of Vogt in various limbal stem cell disorders. These are my references. Thank you.
What is the clinical importance of your study?
We can know from which area we have to harvest the limbal stem cell. If you are planning a surgical procedure, by non-contact procedure, we can image the palisades of Vogt. Wherever the palisades of Vogt are numerous, we can.
But you are saying that if the pigmentation is, it becomes very difficult to pick up these palisades.
Pigmentation is causing the shadowing. Palisades of Vogt are visible as such
You're able to visualize
OCT.
it. Okay.
So have you done any correlation between your OCT and a morphological finding, the actual slit lamp images in these patients?
I have not compared with the slit lamp images because we get the cross section. In slit lamp image, it's a photo.
No, that's what I'm saying. So if you look at the OCT, it's fine. But can you, if you can do a comparison between that and what you actually see on the slit lamp, so that because everybody can't get a OCT done, so
yeah, that would be a future direction.
very interesting.
But good to know that OCT is being used for several newer diagnostic methods. Yeah.